Hey everyone, this is probably going to be ugly, but I'll try to make it quick. I'm just a guy in my basement with a TV and a laptop and an internet connection, just trying to make sense of everything going on. Currently, there is a lot of division. You've got vaccine mandates, QR codes, inflation. Things are changing here quickly. For myself, it doesn't make sense that if you ask the federal government, the inflation is due to a supply chain crisis, yet they're pushing through their mandatory vaccine requirements to sideline a bunch of truckers and further hurt the supply chain. But I'm not a politician, so I can't really weigh in on why they're doing it, but I'm doing this video because humans tend to forget. Sadly, if you've noticed the trend lately, people think history can be erased, but history is something that you should learn from, whether it's 2 months ago, 2 years ago, or 2 centuries ago. Regardless, let's get into the content here. So, we're talking about what is going on here in Canada in regards to COVID with the division and why we have arrived at this point. So let's look at some of the most recent headlines. So apparently, more than 1 in 4 Canadians support jail time for being unvaccinated. Yeah, I didn't misread that. So, supposedly, many Canadians are in favor of a harsh punishment for the unvaccinated, with 37% saying in a new poll it would be acceptable to deny them publicly funded health care, and 27% that it would be okay to go as far as a short jail sentence. Now, I'm just going to pause there. If you're not familiar with how healthcare works in Canada, it's public. You're taxed for it. You pay into it as long as you are a working, contributing member of society. So, 37% saying it would be acceptable to deny them publicly funded health care that they've worked for and paid into. That just seems like an oxymoron to me. I mean, they've paid for it. They've worked for it. And obviously, if you're on that side of the 37%, I wish you well with everything you do in life, but I don't quite think you understand how things work up here in Canada. Here's another article. Oh, get rid of that. We're doing it one and done, raw and dirty. So show compassion to other people. Local health leaders react to attitudes towards this poll. Let's just scroll down here a little bit and let's get to the actual data. So, supposedly, 77% said they feel it's appropriate to continue ongoing restrictions, barring unvaccinated people from entering public spaces and premises such as restaurants, cinemas, libraries, liquor and cannabis stores, and various retail outlets. 61 believe the unvaccinated should pay out of pocket for full medical costs if they're admitted to hospital and ICU because they've contracted it. Like I said, if you're a working, contributing member of society, that fact just seems ridiculous. 61 also believe that unvaccinated should pay monetary health care surcharge up to $150 a month. 37% say hospitals should refuse to allow them access to any publicly funded hospital medical services. Okay, we've touched on why that's just ludicrous, but carrying on. 33% say they should be refused from renewing their driver's license. Alright, if you're an unvaccinated person in this province, you can't go anywhere anyways. But sure, let's refuse them from renewing their driver's license. There is the option to do tests to go to work, but apparently 33% of the population think that, no, I don't care if they are a young family, have children or dependents relying on them to go to work and make money in order to survive. 33% say that they shouldn't be able to renew their driver's license, which means they shouldn't be able to go to work, which means 33% of Canadians say they don't really give a shit whether someone can go out and make a living or not. Alright, well, my 1 year and 3-year-old son would not appreciate that 33%. Anyways, moving on. Here's where we get really carried away. 27% say people who remain unvaccinated should serve up to 5 days as part of a jail sentence for endangering others or overwhelming the healthcare system. Let's just take a moment and talk about overwhelming the healthcare system. It's obviously, it shouldn't be news to you, but there's a lot of things that put strain on the healthcare system. Smokers, for instance. You know, you can go to your gas station down the street and buy a pack of cigarettes. That will kill you. That will most likely put you in need of the healthcare system. But those people don't go to jail for smoking. Obesity, COPD, tons of other health conditions that, you know what? If people cared about their body and were responsible, would never be a thing. Yeah, those also put strain on the healthcare system. So, for those 27% of people, I would ask them, why go after people not getting vaccinated and let everyone else making poor health choices off scot-free? I mean, if you're going to go after one, you should likely go after them all. And if you did, like, honestly, if you can get everyone behind you and we can go after them all, I think that would do loads to help the healthcare system here in Canada because, yeah, it's free. Welcome to Canada, right? Anyways, moving on. We're going to talk a little bit more specifically to the region that I live in. So, here in Alberta, we heard last year that we needed to lock things down. We needed to protect each other. And a lot of it really didn't make sense. But we did it. So, this is where I come back to the fact that humans tend to forget. So last year, the whole push was about overwhelming the healthcare system. And this was when vaccines first became available. This was the first, I guess, division, you could say, between vaccinated and unvaccinated. So, the whole reasoning behind it, we were going to overrun the healthcare system. All right. Now, I haven't even mentioned the fact that tons of healthcare professionals, people that have worked in the healthcare system for over 30 years, were terminated due to the fact they didn't want to get the vaccine. Now, I mean, maybe I'm missing something, but if you're dealing with a situation where your hospitals are going to be overrun and you're not going to have enough beds to put people in, staffing is kind of important. So, similar to the trucking mandates I spoke of earlier, sure, let's just make the problem bigger. Because A, we don't have enough beds or the space to put them. Problem number one. As it morphs into problem number two, well, we have the beds, but we don't have the staff to care for them. And why don't you? Well, that was done by the province. Regardless, let's just take a little look-see here in the past. So, here's an article from April 8th, 2020. Our good old fearless leader, Jason Kenney, proclaimed that Alberta planned to acquire hundreds of ventilators and increase ICU beds by more than 1,000 ahead of the projected May peak. Now, like I said, this was April 8th, 2020. So we were only 1 month into the start of things. Sounds like a great plan. I won't even lie. Sorry if I'm not holding this still, but like I said, this is raw and uncut. I'm just a dude in my basement. Sounds like a good plan. Lots of beds, lots of ventilators. Boom! Let's knock it out of the park. Right? So, in the official modeling release, the province offered further details on how it would respond to the pandemic, including acquiring resources beyond what the model suggests it will need and boosting training for staff. If you're curious, that's the same staff that they let go if they didn't want to get the vaccine. Anyways, moving on. According to the newly released details, 314 ventilators are currently dedicated to COVID-19 in the province, but they plan to bump that number up to 576 by April 22nd and 761 by the end of the month. Not bad. Looks like a good plan, Kenny. As for ICU, they expected to increase ICU capacity by an additional 1,081 beds for COVID-19 by the end of April. This is April 2020, if necessary. So, we'll leave that at there and we'll pull this up because this is interesting. Here we go. This is last updated January 20th, 2022. Alberta Health Services continues to do all it can to ensure we have enough ICU capacity to meet patient demand. We'll ensure that we maintain ICU capacity above daily demand to a planned maximum of 380 beds. And this last part is interesting, as long as staff and physician availability allows. So let me back that up. Staff and physician availability. Why would that be a problem? Oh, right. The government and the vaccine mandates. What did it say back here? An additional 1,081. 241. Now, I don't know if you're very good at math, but if you just took 250 and 1,000 for those numbers, that's 25% of what was promised. Now, you might sit at home and think, rah, 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 the government's done so great. And those unvaccinated people are horrible and should not be able to renew their driver's license and should be subject to jail terms. Whatever you want to think, I'm not going to judge it. I'm totally team neutral. Vaccinated, unvaccinated, I really don't give a shit. I'm looking beyond COVID. I'm looking at what is happening in the world around me and how it is going to affect my family going forward. Now, like I said at the start, people tend to forget. So, if you're sitting at home right now and you think people that are unvaccinated are the problem, or that vaccination is going to get us out of this pandemic, I disagree with both statements. I feel like government mismanagement has got us to this point, whether it be provincial or federal. I mean, I live in Alberta, but we can even talk about, oh, get you out of here. We can even talk about how things have been reported. So, let's look at this. This is an interesting thing that just came out. I've wondered this since the start. Ontario, bless them over there, they decided that they were going to start giving more specific data, so hospitalizations by vaccination status. So here we have in ICU. Now, unvaccinated cases in ICU are at 208. Partially vaccinated cases are at 16, and fully vaccinated cases are at 263. Now, Alberta, they haven't released this type of breakdown for their data, but it makes a guy wonder, because the whole reason that people are against the unvaccinated is because they're going to overwhelm the healthcare system. But if you look at the data that Ontario is putting out, there's more vaccinated people than unvaccinated people currently in the ICU. So, let me put it this way. There's two scenarios. The vaccine is effective, and if you've got it, you're safe. So mind your own business and don't worry about what your neighbor's doing. Or, number two, the vaccine really doesn't work as good as they said. And if that is the case, why would you make it mandatory? If any of you guys are close to Justin Trudeau, or, well, actually, the guy in Quebec, he's already gone and done it. So if you know him, ask him that question. Give him those two scenarios and see what he has to say. Because he's got to pick one, right? Anyhow, this is a startling number. We'll go down for those in hospital but not in the ICU. Oh, wow. That's almost a 3-to-1 ratio. So, for people in the hospital but not in ICU, we got 2,091 fully vaccinated, and we got 740 unvaccinated. Now, I won't lie, I like numbers, and I know that Canada's running on over an 80% vaccination rate. So, yeah. It makes sense that there's more fully vaccinated people in the hospital and not in the ICU. But this is only a small portion of the data. So, these numbers could be better. How could they be better? Well, nowhere on this page can you find risk factors. So, are people overweight? Do they have are they immunocompromised? There's no breakdowns for any of those type of things. Obviously, the more you broke it down, the more you'd be able to understand. But, let's be honest, the government reports this. The more they allow you to understand, the more you might be able to say, there's been government mismanagement. Anyways, moving on. I want to end this with something about psychological stress. So, we'll scroll up to the top here just so you guys can get everything from this. So, This here is a study from NCBI, from the U.S. National Library of Medicine and the National Institutes of Health. All right? And it was a psychological stress in the human immune system. And it was a meta-analytic study of 30 years worth of inquiry. So basically, in a nutshell, we'll go to the abstract. So the present report meta-analyzed more than 300 empirical articles describing a relationship between psychological stress and parameters of the immune system in human participants. Acute stressors lasting minutes, so those would be what would engage your fight or flight response. Say you go hiking and you stumble upon a bear. Whoa! Run away. That's an acute stressor. So those were associated with potentially adaptive unregulation of some parameters of natural immunity and downregulation of some functions of specific immunity. Now, brief naturalistic stressors, such as like an exam, you're a student, you got a test coming up, they tended to suppress cellular immunity while preserving humoral immunity. Chronic stressors, COVID, were associated with suppression of both cellular and humoral measures. I mean, if you turn the TV on every day, the people on the TV tell you to be scared, don't go anywhere, stay home, shelter in place, abandon your friends, your family, and all of your social circles. That's pretty chronic. Anyways, effects of events sequences varied according to the kind of event or trauma versus loss. Now, when we're talking about COVID, there's a lot of loss, not a lot of trauma. You're stuck in your house, but humans are social people, or we're social. We need social connections. Sure, you can see someone on a screen, but it's not the same as the face-to-face interaction. You go out and about, everyone's got a mask on their face. How long has it been since you smiled at someone and they smiled back? You wouldn't know, because you're all wearing masks. Regardless, continuing, subject reports of stress generally did not associate with immune change. In some cases, physical vulnerability as a function of age or disease also increased vulnerability to immune change during stressors. Okay, so let's reread that. Subjective reports did not associate with immune change. Alright, well, what does the word subjective mean? Well, subjective means that it affects everybody differently. Now, if you want to call COVID subjective, sure, go ahead. But I'm pretty sure these restrictions that we're all dealing with and living in, I think they affect everyone the same. This is why, honestly, right up here, ncbi.nlm.nih.gov/PMC, /PMC/articles/PMC 1361287 /. If you have the time, I would encourage you to pull this up and read the whole article. But I said I'd try to make this quick, so we're going to scroll down here to the conclusion part, because this gets very in-depth. More in-depth than I'm going to go into this video, but here we go. This is the conclusion. So, stress-related disease emerges predominantly out of the fact that we so often activate a psychological system that has evolved from responding to active physical emergencies. But we turn it on for months on end if you're worried about mortgages, relationships, and promotions. So, let's just scroll that back up to the top now that we've got that in reference. So, mortgages, relationships, and promotions. Brief naturalistic stressors tend to replace cellular immunity. Chronic stressors. That's the word we're looking for. Chronic. So something chronic goes on for months, or in the case of this virus, years. But anyways, I just want to make that connection for you guys. Now, finishing it off, here we go. The results of this meta-analysis support the assertion in one sense. Stressors with the temporal parameters of the fight or flight situations faced by humans. 11 evolutionary ancestors elicit potentially beneficial changes in the immune system. So, if this was something that happened sporadically, you're out for a hike and you run into a bear, oh, geez, you climb the tree, you get away, you're safe. Great. Those things could potentially be beneficial. But the more a stressor deviated from those parameters by becoming more chronic, COVID, the more components of the immune system were affected in a potentially detrimental way. Now, of course, they go on to say that further research is needed to support the other ideas elicited by this quote. But at the end of the day, I'm going to wrap it up like this. If you are at home and if you are scared, and you have been scared or worried or concerned for the last 2 years, you have effectively been reducing your immune system on top of all those other things such as mortgages, relationships, and promotions. It's just another thing in the pot. So, if the government was really doing all of this for your health, and if the government was really doing all of this because they wanted to help us, and they wanted to make sure there was food in the grocery stores, and the supply chains were operating at full capacity in order to combat the so-called inflation that has been caused by COVID in the supply chain, you would be like me. You would be very surprised at what they are doing. It's unbelievable that we are in the situation where we are when they've had time. Prime example, Jason Kenney in Alberta announcing over 1,000 ICU beds. Oh, get out of here. And we currently have 241. You've had over 2 years, Jason Kenney. Well, I guess not over 2 years. Coming up on 2 years in April. But where are our beds? Who knows? Maybe he's got them, but he can't staff them. And why would that be? Oh, right. Mandatory vaccination. I'm just a guy sitting in his basement watching things go by and wondering, when can we get back to being Canadian? You know? The true north, strong and free. I grew up in a place where you knew your neighbor. You knew where your food came from. You knew that if you went and worked hard and were honest, you'd be alright. You'd be looked after. And with what I see now, the government is starting to scare me. If you feel the same, then by all means, I ask you to share this video. I'm not your regular YouTuber, the whole like, subscribe, blah, blah, blah. Yeah, no, get out of here. I'm just a guy starting to ask questions. And I want you guys to ask questions too. If you see this, and any of this makes you ask questions, well, you have access to the same thing I do, provided you have internet. Google it. Look it up. If what you find doesn't sit right with you, say something about it. Because that's where I'm at. Hope you all have a good night. Just a random guy sitting in his basement. Cheers.